Well, welcome. We have just finished the roundtable on the transformative power of shared information within health systems. And can you pinpoint for us, from your perspective, what were the most important outcomes?
From my perspective, it was about sharing that electronic medical records and clinical decision support are platforms, but alone they do not improve patient care. It takes a culture of an organization and the empowerment of team members, so healthcare team members, especially the pharmacists, to be involved in the improvement of patient care outcomes.
Great, thank you. And you mentioned quite a few initiatives that have been put in place from Kaiser Permanente. Can you tell us about any challenges that you had, especially when it comes to for example, the anticoagulation involvement or the prevention of further morbidity with coronary artery disease?
Well, I think the anticoagulation service would be a good example of the kind of challenges that we had. When we were first asked by primary care physicians to develop an anticoagulation service, the cardiologists and the orthopedic surgeons who do a lot of anticoagulation work said, well, why would we need pharmacists to help us? So we worked with the primary care physicians first, and then soon the cardiologists and orthopedic surgeons got on board very fast, and today they have turned over all of the anticoagulation management to our pharmacist team.
Well, great, because the results have been wonderful. I was really impressed with them. And can you FIP represents pharmacists all around the world, and for many different organizations that have a lot of different challenges based on location. Can you offer a few words of advice to us on how to support these measures in other countries or within other organizations?
Well, I think you have to start small with pilot projects, and you find physicians who are interested in collaborating with pharmacy. That was always been our success model. Start small with pilots, with collaborating physicians, and then show your value and show your successes. Document what you do and work with the physician and the rest of the healthcare team to, in fact, then gain empowerment for expanded services, taking care of more patients, and also then involving more physicians.
Great, and have you had any feedback from the pharmacists themselves as to how they like working on these particular projects within a clinical setting?
Well, they feel they've got the best job in the world because they get to use the knowledge, the training that they've had, their education, and in fact, they're valued. They're so highly valued by our physicians that our physicians say, we will not practice in Permanente without clinical pharmacists by my side.